I'm Dr. Maya Collins, a dermatologist at Crestwood Medical Center, where I have dedicated the past 15 years to exploring the intricate world of rare skin conditions. Throughout my career, I've witnessed remarkable advancements in dermatological science, advances in imaging techniques, molecular biology, and immunology that have transformed how we understand skin disease. Crestwood itself has earned a reputation as a leading institution for skin pathology research, attracting patients with puzzling disorders from across the region. Yet, despite all these breakthroughs, I recently encountered a case that unsettled my clinical instincts and challenged everything I thought I knew about dermatology. The mystery began quietly, as so many do, with a single patient's unusual complaint. It was a crisp autumn morning when Lucas Bennett walked into our dermatology wing, a modern facility equipped with the latest diagnostic tools and staffed by a multidisciplinary team committed to dermatological innovation. Lucas was a healthy 27-year-old man, with no prior history of skin disease or trauma. He had come to us because of something that defied explanation, a scar that had appeared overnight on his left forearm. What made Lucas's case so perplexing was not just the suddenness of the scar's appearance, but its entirely spontaneous nature. He reported waking up to find this fresh, well-defined mark etched on his skin, with no memory of injury, abrasion, or burn. His medical history was unremarkable. There was no recent travel, no exposure to toxins or allergens, and no family history of autoimmune or dermatological disorders. It was as though the scar had materialized out of thin air. At Crestwood, cases like Lucas's ignite a professional curiosity that borders on obsession. Our dermatology wing, a clean expanse of glass and steel, buzzed with the energy of clinicians and researchers eager to unravel this enigma. The team I lead includes experts in skin imaging, molecular diagnostics, and immunopathology, all of whom embraced the challenge with remarkable enthusiasm. Lucas's initial examination was carefully thorough. The scar was approximately 4 centimeters long, slightly raised, with a pale, almost translucent quality. There was no surrounding inflammation, no sign of infection or irritation. The texture was unusual, not quite like a typical hypertrophic scar or a keloid, but something altogether different. It lacked the usual characteristics of healed injury or dermal remodeling. Intrigued, I took detailed photographs and prepared to proceed with a battery of tests. Despite the high-tech environment and our collective expertise, the clinical picture was confounding. I found myself returning to the fundamental questions. How could a scar, a physical mark of tissue repair, manifest without any known trauma? What cellular processes could be responsible for such an abrupt and isolated event? The skin, after all, is a resilient organ designed to repair itself after injury, but does not typically generate scars spontaneously. As a specialist in rare skin conditions, I had encountered unusual presentations before, from autoimmune blistering diseases to obscure genetic disorders, but never anything quite like this. The scar's appearance begged us to look deeper, beyond the superficial, into the microscopic and molecular layers that govern skin health and pathology. Crestwood Medical Center has long prided itself on integrating cutting-edge diagnostic imaging into clinical practice. We employ advanced dermoscopy, confocal microscopy, and even high-resolution optical coherence tomography, all tools that provide unprecedented views beneath the skin surface. I scheduled Lucas for immediate imaging studies, hoping they might reveal subtle clues invisible to the naked eye. Our pathology lab, equipped for rapid biopsy processing and molecular analysis, stood ready. Yet even before the tests began, the case had already begun to unsettle me. It was a stark reminder that despite decades of progress, the skin still held secrets. The sudden appearance of a scar without injury was not just an anomaly. It was a puzzle that questioned the very mechanisms of tissue repair and scarring that underpin dermatology. What compounded the mystery was Lucas himself. He was remarkably composed, despite the strangeness of his condition. His curiosity about the scar mirrored my own, and his willingness to participate in every test and procedure was a testament to his trust in our care. There was a palpable human dimension to this clinical enigma, a young man suddenly marked by something inexplicable and irreversible. As we began our initial investigations, I found myself reflecting on the nature of scars. They are more than just physical reminders. They are narratives written in skin, stories of injury, healing, and sometimes of unseen forces at work beneath the surface. Lucas's scar seemed to carry a story we had yet to understand, a narrative waiting to be decoded by science and medicine. In the days that followed, I convened with my team to discuss the case at length. We reviewed Lucas's history, scrutinized the clinical photographs, and planned our diagnostic approach. The consensus was clear. This was no ordinary scar, and it warranted an exhaustive investigation that would push the boundaries of our current knowledge. Our first step was to perform a skin biopsy, a procedure we undertake routinely, but one I approached with particular care, given the unusual presentation. The biopsy would allow us to examine the cellular architecture and composition of the scar tissue, searching for clues about its origin and evolution. Alongside histological examination, we planned immunohistochemical studies to detect markers of inflammation, fibrosis, and cellular stress. Additionally, we scheduled blood tests to screen for systemic causes that might explain the phenomenon, autoimmune markers, inflammatory cytokines, and connective tissue disease panels. Lucas's lack of symptoms beyond the scar itself made these tests a long shot, but ruling out systemic involvement was essential. Throughout this process, I remained acutely aware that we were navigating uncharted territory. In dermatology, the skin is both our canvas and our command center, a window into systemic health and localized disease. Yet here was a scenario that defied conventional wisdom, a visible mark of repair without a known insult. The weight of responsibility was real. I felt the tension between scientific rigor and the human element, the need to apply evidence-based medicine while acknowledging the limitations of our understanding. Lucas's scar was a silent challenge, a call to remain humble in the face of the unknown. As the initial tests were underway, I found myself revisiting the broader implications of this case. Could it represent a novel dermatological entity? Was it a manifestation of an undiscovered pathological process? Or was it a transient event, a rare outlier in the spectrum of skin responses? The questions multiplied, each more complex than the last. But that is the essence of medicine, a continual journey into the mysteries of the human body, where each patient presents a unique story and every scar, visible or invisible, tells a tale waiting to be told. Lucas's case had begun as an anomaly, a clinical curiosity, but already it was shaping into something more profound, a testament to the unending quest for knowledge that defines our profession. At Crestwood Medical Center, with its commitment to innovation and interdisciplinary collaboration, I felt confident that we would pursue these questions with every resource at our disposal. This was only the beginning. Crestwood Medical Center's dermatology wing is a carefully designed space where natural light floods through expansive windows, illuminating sleek workstations and state-of-the-art diagnostic equipment. It's a place where cutting-edge science meets compassionate care, and where complex skin disorders are met with multidisciplinary expertise. It was here, amid the hum of activity and quiet determination, that Lucas Bennett's case began to unfold, a case that would soon capture the full attention of our entire team. Lucas arrived for his second appointment a week after his initial visit, his forearm now the focus of countless questions and examinations. He was a young man in the prime of his life, active, health-conscious, and without any chronic illnesses or prior skin conditions. His demeanor was calm, but a subtle tension lingered beneath the surface, the understandable anxiety of facing an unexplained physical change that seemed to have appeared out of nowhere. From the moment he stepped into our consultation room, I could sense the weight this scar carried for him. It was not just a mark on his skin, it was an intrusion into his sense of normalcy. There was no history of trauma, no recollection of injury, no recent exposure to chemicals or environmental hazards. Lucas was adamant that he had not scratched or bumped the area, nor had he experienced any symptoms such as itching, burning, or pain. He was baffled, as were we. Our initial clinical assessment revealed a scar that defied typical classification. It was sharply demarcated, pale, and slightly raised, without the redness or tenderness that often accompany new scars. The texture was firm but smooth, and there was no evidence of ulceration or breakdown. Surrounding skin appeared entirely normal, and there were no satellite lesions or signs of systemic involvement. I carefully examined every aspect of the lesion, running my fingers gently over the surface to assess its consistency and adherence to underlying tissues. The scar seemed superficial, yet surprisingly resilient. It was unlike any hypertrophic scar, keloid, or atrophic scar I had encountered in years of practice. This was a lesion that seemed to have developed in defiance of the skin's usual healing processes. Given the unusual presentation, I requested a comprehensive review of Lucas's medical history, lifestyle, and recent activities. He was a software engineer with no history of outdoor work or hobbies that might expose him to unusual physical stressors. He reported no recent infections, fevers, or systemic symptoms. There was no family history of dermatological diseases, autoimmune conditions, or connective tissue disorders. His medications were limited to occasional over-the-counter vitamins. Despite the thoroughness of our inquiry, no red flags emerged. The scar's sudden appearance remained an isolated event, unaccompanied by any systemic signs. This absence of context made the case all the more perplexing. The dermatology wing at Crestwood benefits from a dedicated team of specialists who collaborate closely on challenging cases. On this day, I convened a meeting with Dr. Anil Sharma, our immunologist, Dr. Rachel Lin, a neuropathologist, and Dr. David Chun, a clinical researcher specializing in connective tissue. We gathered around a large monitor displaying high-resolution images of Lucas's scar, reviewing every angle in detail. Our discussion was candid and exploratory. Dr. Sharma raised the possibility of an unusual autoimmune reaction localized to the skin, though he noted the lack of inflammation and systemic markers made this less likely. Dr. Lin wondered if there might be a subtle neurological component, perhaps a dysregulated nerve-mediated process affecting local tissue repair. Dr. Chun suggested the possibility of a novel fibrotic mechanism, one that might evade standard diagnostic criteria. Lucas sat quietly nearby, absorbing the conversation with a mixture of hope and apprehension. His calm demeanor belied the inner turmoil of facing an unknown condition that challenged even the most experienced clinicians. His family, too, had become involved, supportive yet anxious, eager for answers that we struggled to provide. In the days following this meeting, we embarked on a series of diagnostic tests designed to probe every conceivable angle. Skin biopsies were performed using minimally invasive techniques, ensuring patient comfort while obtaining sufficient tissue for analysis. The samples were sent to our pathology lab, where technicians prepared slides for histological examination and molecular studies. Blood workups were extensive. We screened for autoimmune antibodies, inflammatory markers, infectious agents, and metabolic abnormalities. Allergy panels were conducted to rule out hypersensitivity reactions. Lucas underwent imaging studies, including high-frequency ultrasound of the affected area, searching for subtle changes in dermal and subdermal structures. Throughout these investigations, Lucas remained engaged and cooperative. His willingness to participate in repeated tests reflected a trust that was both humbling and inspiring. He often asked thoughtful questions about the procedures and their potential outcomes, demonstrating a desire to understand his condition beyond the clinical jargon. Despite the breadth of our testing, early results were frustratingly inconclusive. Histology revealed scar tissue consistent with fibrosis, but lacked inflammatory infiltrates or signs of active pathology. Blood tests returned within normal limits, with no evidence of systemic autoimmune or infectious disease. Imaging studies showed a well-demarcated area of dermal thickening, but no underlying structural abnormalities. The enigmatic nature of Lucas's scar resonated deeply within our team. It was a paradox, a clear physical manifestation without an apparent cause. Our clinical acumen and technological resources had reached their limits, and yet the story of this scar was far from complete. As the days turned to weeks, I spent considerable time reflecting on the implications of this case. The skin, often described as the body's largest organ, serves as both a barrier and a mirror to internal health. It reacts to trauma, infection, and systemic disease with a predictable set of responses: redness, swelling, pain, healing, and sometimes scarring. But here was a scar that had emerged absent any of those triggers. Lucas's case underscored how much remains to be discovered in dermatology. The skin's complexity extends beyond its surface, involving intricate interactions between cells, the immune system, nerves, and the extracellular matrix. In this instance, the usual pathways of injury and repair seemed bypassed or altered in ways we had yet to understand. The emotional weight of this uncertainty was palpable. Lucas expressed a mixture of frustration and fascination, grappling with the reality of living with a visible mark whose origin was a mystery. His family, too, oscillated between hope for resolution and anxiety over the unknown. In the clinical setting, I was reminded of the essential balance between scientific rigor and empathy. While we pursued every diagnostic avenue, I endeavored to provide reassurance and support, acknowledging the psychological impact of an unexplained physical change. Lucas's journey had become a shared endeavor, uniting patient and clinicians in a quest for answers. It was a testament to the collaborative spirit that defines Crestwood Medical Center, a place where curiosity fuels discovery and where every patient's story is valued. As we awaited further results and planned the next steps, the scar remained, a silent, mysterious presence on Lucas's forearm. It was a reminder that, despite modern medicine's advances, the human body continues to hold secrets that challenge our understanding and inspire ongoing inquiry. The initial round of diagnostic tests on Lucas Bennett's mysterious scar yielded results that were as perplexing as the lesion itself. The biopsy samples showed fibrotic tissue consistent with scarring, but without the inflammatory cells or immune activity we usually expect in such processes. His blood work was normal, with no autoimmune markers or signs of systemic disease. Imaging revealed a localized dermal thickening, but no underlying structural abnormalities. The absence of a clear cause left us with more questions than answers. Faced with this conundrum, I began considering potential explanations rooted in rare dermatologic phenomena. Could this be an atypical autoimmune response localized strictly to the skin? Was there a novel form of tissue remodeling occurring, one that bypassed the usual inflammatory cascade? Perhaps an unusual environmental or chemical exposure had triggered a silent scarring process. Each hypothesis had its merits and flaws, and none fit perfectly. Our initial treatment approach reflected the most plausible explanations. Given the scar's fibrotic nature and the possibility of subtle immune dysregulation, we decided to begin topical corticosteroids to reduce any undetected inflammation. We also introduced topical immunomodulators, agents designed to modulate the skin's immune activity and potentially halt further progression of the lesion. Lucas was informed about our rationale and the experimental nature of this treatment plan. Despite the uncertainty, he was eager to proceed, hopeful that the interventions might improve or stabilize the scar. His trust in our expertise was both humbling and motivating. The first week of treatment saw Lucas applying the prescribed creams diligently, and he returned to the clinic for close monitoring. At this stage, the scar's appearance remained largely unchanged. No reduction in size or elevation, and no new symptoms. There was no evidence of irritation or adverse effects from the medications, which was reassuring. However, by the end of the second week, subtle changes began to emerge. The scar's borders appeared slightly more defined, and Lucas reported a faint sensation of tightness around the lesion. Although there was no overt inflammation or pain, these subjective feelings hinted at ongoing tissue remodeling beneath the surface. We escalated our vigilance, increasing clinic visits and repeating skin assessments. Lucas's commitment remained steadfast, and his engagement in the process offered a vital partnership as we navigated this clinical uncertainty together. Despite our best efforts, by the fourth week the scar showed no signs of regression. In fact, it had subtly increased in size, now extending to cover a slightly larger area of the forearm. The texture remained firm and pale, with no new discoloration or ulceration. This progression, though modest, was concerning. It suggested that the underlying pathological process was active and resistant to initial therapies. Recognizing the need for deeper insight, I arranged for additional laboratory and imaging studies. We performed repeat skin biopsies, this time obtaining larger samples to allow for more extensive molecular and immunohistochemical analyses. The pathology team examined markers related to fibrosis, cellular proliferation, and extracellular matrix remodeling. We also included advanced imaging techniques, such as high-resolution ultrasound elastography, aiming to characterize the scar's biomechanical properties and tissue stiffness. Meanwhile, Lucas underwent a comprehensive review by our allergy and immunology colleagues. We expanded allergy testing to include uncommon environmental and chemical agents, ensuring no potential triggers were overlooked. Blood was drawn for an extended panel of cytokines and growth factors implicated in fibrotic diseases, seeking subtle systemic signals that might have been missed initially. Throughout this period, the emotional dimension of Lucas's experience became increasingly apparent. The scar's persistence and progression weighed heavily on him. He expressed frustration at the lack of clear answers and worry about the lesion's potential implications. His family, ever supportive, shared his concerns, and their involvement underscored the profound human impact of medical mysteries. In clinic, I emphasized open communication, encouraging Lucas to share his feelings and questions. We discussed the limits of current dermatological knowledge and acknowledged the possibility that this might represent a novel or rare pathology. This honesty helped build a therapeutic alliance grounded in trust and transparency. The results of the extended investigations arrived in stages. Repeat biopsies confirmed the presence of dense collagen deposition, characteristic of fibrosis, but again showed minimal inflammatory infiltrate. Immunohistochemical staining highlighted increased expression of transforming growth factor beta, TGF-beta, a key mediator of fibrotic processes. This finding aligned with the scar's progressive nature and suggested active fibrogenesis at the molecular level. Ultrasound elastography revealed increased stiffness within the lesion compared to surrounding tissue, confirming the clinical impression of a firm, fibrotic plaque. Allergy testing remained negative, as did extended blood panels for systemic inflammation. These findings had important implications. They indicated that Lucas's scar was an active fibrotic lesion, driven by molecular pathways promoting collagen deposition and tissue remodeling, yet occurring in isolation without the typical triggers of inflammation or injury. This was unusual and challenged established paradigms of scar formation. Faced with these insights, we adjusted our therapeutic strategy. Antifibrotic agents, though not widely used in dermatology, offered a potential avenue. We discussed the off-label use of topical and systemic medications known to interfere with fibrogenic signaling, including low-dose nintedanib and pirfenidone, drugs primarily used in pulmonary fibrosis but with emerging dermatological applications. Lucas was thoroughly counseled on the experimental nature of this approach, potential side effects, and the need for close monitoring. After careful consideration, he consented to begin a trial of topical antifibrotic therapy, supplementing the ongoing immunomodulatory treatments. The subsequent weeks involved meticulous follow-up. We documented clinical changes with serial photographs, objective measurements, and patient-reported outcomes. Lucas remained engaged, his resolve undiminished despite the uncertainty. Throughout this process, I found myself reflecting on the complexities of dermatological science. Scar formation is a fundamental biological response, yet here was a case that defied the usual logic. No injury, no inflammation, yet active fibrosis progressed unchecked. It underscored the limitations of our current understanding and the need for ongoing research into the molecular drivers of skin pathology. Lucas's case also highlighted the importance of patient-centered care in the face of medical ambiguity. His experience emphasized that beyond tests and treatments, the emotional and psychological dimensions of living with unexplained conditions demand our attention and compassion. As the anti-fibrotic therapy progressed, we remained cautiously optimistic. While clear regression of the scar had yet to be observed, the lesion's rapid progression appeared to slow, suggesting some degree of therapeutic effect. This tentative improvement provided a glimmer of hope amid the uncertainty. Lucas's journey through diagnosis and treatment was far from over, but his resilience and willingness to journey into the unknown inspired our entire team. His case was a vivid reminder that medicine is as much an art as a science, a constant balancing act between knowledge and mystery, intervention and observation. At Crestwood Medical Center, with its commitment to innovation and interdisciplinary collaboration, we continued to pursue every available avenue to unlock the secrets behind this enigmatic scar. The story unfolding on Lucas's forearm was far from complete, and each step brought us closer to understanding a condition that challenged the very foundations of dermatological medicine. As the weeks passed, Lucas Bennett's scar took on an increasingly complex character, defying every expectation we held about skin pathology. What had begun as an isolated, puzzling lesion was now evolving in ways that challenged not only our diagnostic acumen, but our fundamental understanding of tissue behavior. The scar's texture subtly shifted, developing an almost waxy sheen under close inspection, and Lucas began to report intermittent sensations, tingling, mild numbness, that radiated faintly beyond its borders. These new symptoms introduced a layer of urgency and complexity to the case, prompting us to broaden our investigative lens. At Crestwood Medical Center, when a case defies conventional explanations, we harness the collective expertise of a diverse team. Recognizing that Lucas's evolving symptoms might implicate neurological involvement, I called upon Dr. Rachel Lynn, our neuropathologist, and Dr. Michael Patel, a neurologist with a specialty in peripheral nerve disorders. Together, we embarked on a new phase of inquiry, determined to unravel the deeper mechanisms at play beneath the enigmatic scar. Lucas underwent a battery of advanced diagnostic tests designed to explore both the skin's structure and its neural connections. High-resolution magnetic resonance imaging, MRI, of his forearm was prioritized, allowing us to visualize soft tissue and nerve pathways with remarkable clarity. Concurrently, nerve conduction studies and electromyography were performed to assess the functional integrity of the peripheral nerves in the affected region. The MRI scans revealed something neither we nor the radiology team had anticipated: a subtle, previously undetected structure beneath the scar tissue. It was an area of altered signal intensity within the subcutaneous tissue, suggestive of a localized mass or fibrotic deposit encasing small nerve fibers. This discovery was startling. It hinted at a physical substrate that might explain the new sensory symptoms Lucas was experiencing. Nerve conduction studies added further nuance. While there was no evidence of widespread neuropathy, localized slowing of conduction velocity was detected in the small sensory nerves traversing the area beneath the scar. Electromyography showed no signs of muscle denervation or motor involvement, reinforcing the idea that the process was confined to sensory fibers. These findings galvanized our team's efforts. The interplay between skin and nerve tissue is a frontier in dermatological research, and Lucas's case seemed to exemplify a novel pathological process bridging these realms. We hypothesized that the scarring process might be intertwined with nerve tissue remodeling or dysfunction, a complex dance between fibrosis and neural alteration. To explore this hypothesis, we expanded our diagnostic repertoire. Skin biopsies were repeated with a focus on deeper tissue layers, aiming to capture nerve fibers within the fibrotic matrix. We collaborated closely with Dr. Lynn's neuropathology laboratory, which utilized immunohistochemical staining techniques targeting neural markers such as S100 neurofilament proteins. These stains illuminated nerve fibers embedded within the scar tissue, revealing subtle yet significant abnormalities, distorted morphology, evidence of axonal degeneration, and perineural fibrosis. These microscopic revelations offered the first concrete clues to the mystery. It appeared that the scar was not merely a superficial skin lesion, but a manifestation of a deeper pathological process involving nerve tissue encased in fibrotic material. This interplay could account for the sensory symptoms and the resistant nature of the lesion. Meanwhile, Lucas's clinical picture evolved. He described episodes of sharp, intermittent discomfort, brief flashes of pain interspersed with numbness, that added a new dimension to his experience. These symptoms, although distressing, were localized and did not impair his daily activities. Nonetheless, they underscored the urgency of understanding and managing this condition. Our multidisciplinary team convened to synthesize these findings and chart a path forward. The complexity of Lucas's scar demanded a treatment approach that addressed both the fibrotic and neural components. We deliberated the potential risks and benefits of interventions, ranging from localized corticosteroid injections to neuromodulatory therapies. At the same time, we recognized the importance of careful monitoring. The scar's progression and Lucas's symptoms necessitated frequent reassessment, with particular attention to changes in sensory function and tissue characteristics. Advanced imaging and electrophysiological studies were scheduled at regular intervals to track the lesion's trajectory. Throughout this period, the emotional and psychological impact on Lucas was palpable. Living with a visible, unexplained scar that was now linked to nerve involvement introduced uncertainty and anxiety. I made it a priority to engage in open, empathetic dialogue, ensuring that Lucas felt heard and supported. His resilience and willingness to participate actively in his care were inspiring, fueling our commitment to uncover answers. The case also stimulated intense academic curiosity within our center. We began exploring the scientific literature for parallels, reports of neurofibrotic processes, rare connective tissue disorders affecting nerves, and unusual scar variants. The absence of closely matching cases underscored the novelty of Lucas's condition and highlighted the need for further research. Collaborations were initiated with external experts in neurodermatology and fibrotic diseases, expanding the circle of inquiry. Grant applications were drafted to support molecular studies aimed at dissecting the cellular pathways linking fibrosis and nerve pathology in this context. Lucas's case was rapidly becoming a catalyst for interdisciplinary investigation, bridging dermatology, neurology, and pathology. As the weeks unfolded, our team remained vigilant. The scar's progression appeared to stabilize somewhat, and Lucas's sensory symptoms fluctuated but did not intensify. Therapeutic options were carefully weighed, and a plan combining topical antifibrotic agents with low-dose neuromodulators was proposed, aiming to mitigate both fibrotic activity and nerve irritation. Lucas accepted this plan, motivated by the prospect of symptom relief and improved scar appearance. We emphasized the experimental nature of these interventions and the necessity of close follow-up to assess efficacy and safety. This phase of Lucas's journey was a vivid reminder of medicine's evolving nature, a field where clinical observation, technological innovation, and scientific inquiry converge to illuminate the unknown. His scar, once a silent enigma, was now revealing layers of complexity that extended beyond the skin's surface, challenging established paradigms and inviting new perspectives. In the quiet moments between consultations, I often found myself contemplating the broader implications. Lucas's case exemplified the intricate relationships between tissue types, the interplay of structure and function, and the delicate balance disrupted in disease. It underscored how much remains to be discovered beneath the skin, both literally and figuratively. As we pressed forward, Lucas's story became a shared journey, uniting patient and clinicians in pursuit of understanding. His scar was no longer simply a mark on his forearm. It was a window into the hidden complexities of human biology, a testament to the mysteries that continue to inspire and challenge us in medicine. Lucas Bennett's case had evolved from a puzzling dermatological anomaly into a complex clinical enigma, one that now commanded the attention of an expanding circle of experts within Crestwood Medical Center. Recognizing the multifaceted nature of his condition, which intertwined fibrotic skin changes with nerve involvement, we convened a special interdisciplinary skin disease board. This group brought together clinicians and researchers from dermatology, immunology, pathology, neurology, and radiology, each contributing unique perspectives and expertise. Our first formal meeting was held in one of Crestwood's conference rooms, a space designed to foster collaboration with its circular seating arrangement and large digital screens for sharing imaging and histological slides. Around the table sat Dr. Anil Sharma, our immunologist, Dr. Rachel Lin, the neuropathologist, Dr. Michael Patel, neurologist, Dr. David Chun, connective tissue specialist, and myself. We were soon joined by members of the clinical research team and patient advocacy coordinators, reflecting the holistic approach Crestwood champions. The atmosphere was one of intense focus and mutual respect. Each specialist presented their findings on Lucas's case, laying out the clinical history, imaging studies, biopsy results, and electrophysiological data. The scar's progression, the subcutaneous fibrotic mass encasing nerve fibers, and the sensory symptoms painted a picture that defied existing diagnostic categories. Dr. Sharma initiated discussion by highlighting the absence of systemic autoimmune markers despite the active fibrosis. He proposed that localized immune dysregulation might be at play, perhaps triggered by an unknown environmental or genetic factor. Dr. Lin emphasized the neuropathological evidence of perineural fibrosis and axonal degeneration, suggesting a neuroinflammatory process that might be both cause and consequence of the fibrotic changes. Dr. Patel contributed insights from neurology, noting that the focal slowing of nerve conduction aligned with the clinical symptoms of intermittent pain and numbness. He cautioned that prolonged nerve compression or fibrosis could lead to irreversible damage if not addressed. Dr. Chun underscored the unusual nature of the fibrotic tissue, which seemed to bypass typical inflammatory pathways, raising the possibility of a novel connective tissue disorder. As the discussion progressed, it became clear that Lucas's condition was more than a dermatological curiosity. It was a complex interplay of skin, nerve, and immune mechanisms that challenged conventional boundaries. The team debated potential diagnostic classifications, considering rare fibrotic neuropathies, localized scleroderma variants, and even emerging neurocutaneous syndromes. Lucas's case was also discussed in the context of similar, albeit less well-characterized, conditions documented in limited case reports. The scarcity of comparable cases underscored the novelty of his presentation and the urgent need for detailed documentation and research. Throughout the meeting, Lucas's family members participated remotely via video call, their presence a poignant reminder of the human dimension behind the medical data. Their questions and observations added depth to the clinical picture, highlighting the psychological and social impact of living with an unexplained and progressive condition. They expressed gratitude for the comprehensive care and the multidisciplinary approach, which provided a sense of hope amid uncertainty. Following the board meeting, we formalized a collaborative care plan. This included coordinated interventions targeting fibrosis and nerve involvement, regular multidisciplinary follow-ups, and a structured schedule of imaging and electrophysiological assessments. Importantly, the plan incorporated psychosocial support services, recognizing the emotional toll on Lucas and his family. The interdisciplinary team also prioritized research initiatives. We proposed enrolling Lucas in an observational study designed to investigate novel fibrotic and neuroinflammatory mechanisms in skin diseases. This study involved advanced molecular profiling, including gene expression analysis and cytokine profiling, aiming to uncover underlying pathways driving his condition. To facilitate this, we partnered with the hospital's Translational Research Center, which provided access to cutting-edge laboratory facilities and bioinformatics expertise. This collaboration exemplified Crestwood's commitment to bridging clinical care with scientific discovery. Lucas's engagement throughout this process was remarkable. Despite the growing complexity of his condition and the uncertainty about prognosis, he remained proactive and hopeful. He participated in research discussions, asked insightful questions about emerging therapies, and advocated for patient-centered approaches. His resilience and openness fostered a strong therapeutic alliance, motivating the entire team. The broader hospital community also took notice. Lucas's case became a topic of discussion in grand rounds and journal clubs, stimulating dialogue about rare fibrotic skin disorders and neurocutaneous interactions. It sparked interest among trainees and seasoned clinicians alike, reminding us all of the ever-present need to remain curious and open-minded. In parallel, Lucas and his family navigated the emotional landscape of living with an enigmatic disease. The involvement of patient support services provided counseling and coping strategies, helping them manage anxiety and uncertainty. This holistic care underscored that medicine extends beyond biology to encompass the full spectrum of human experience. As the weeks turned into months, the collaborative efforts at Crestwood deepened. Regular meetings ensured that diagnostic data and clinical observations were continually integrated, allowing for dynamic adjustments to the care plan. New findings from molecular studies began to emerge, hinting at pathways involving aberrant fibroblast activation and neuroimmune crosstalk. These discoveries fueled optimism that understanding Lucas's condition might extend beyond his individual case, offering insights applicable to broader categories of fibrotic and neurocutaneous disorders. The potential to contribute to medical knowledge while advancing patient care was a powerful motivator. Yet, uncertainty remained. The natural history of Lucas's condition was still unfolding, and therapeutic options were limited. The team grappled with balancing intervention against observation, weighing the risks and benefits of emerging therapies with incomplete evidence. Through it all, the collaborative spirit within Crestwood shone brightly. The intersection of diverse specialties, the integration of clinical and research efforts, and the partnership with Lucas and his family exemplified a model of care designed to confront complexity with compassion and rigor. Lucas's journey had become emblematic of the challenges and possibilities inherent in modern medicine. His scar, a once inexplicable mark, was now a focal point for interdisciplinary inquiry, a symbol of the unknown made tangible. In embracing this challenge together, we reaffirmed our commitment to patient-centered innovation and the relentless pursuit of understanding in the face of medical mystery. In my years as a dermatologist specializing in rare skin conditions, I have often encountered cases that stretch the limits of our knowledge, but none quite like Lucas Bennett's. As his scar evolved from a clinical curiosity into a complex, multifaceted enigma, I found myself increasingly drawn into the depths of uncertainty that define the edges of medical understanding. The case challenged not only my scientific expertise, but also my emotional resilience and capacity for empathy. Each day brought new layers of complexity. The scar, once a solitary lesion, had become a nexus of intersecting pathologies, fibrotic remodeling entwined with nerve involvement, a biological puzzle resisting conventional frameworks. The interdisciplinary team's efforts had illuminated some aspects, yet the core mystery persisted. This was a humbling reminder that despite advances in dermatology and related fields, the human body retains an element of unpredictability. I often reflected on the metaphor the scar had become, a visible manifestation of hidden processes, both biological and psychological. It forced me to confront the limits of certainty in medicine, where even with the most sophisticated tools, answers can remain elusive. In these moments, the practice of medicine transcends diagnostics and treatments. It becomes a profound engagement with ambiguity. Professionally, Lucas's case deepened my fascination with the skin's intricate biology. It underscored how the skin is not merely a protective barrier, but a dynamic interface where immune responses, neural signals, and connective tissue remodeling converge. The interplay we observed in his scar revealed pathways we had yet to fully characterize, highlighting the need for ongoing research at the intersection of dermatology, neurology, and immunology. This intellectual challenge invigorated my scientific curiosity. I delved into the literature, exploring emerging studies on neuroimmune interactions and fibrotic mechanisms. I connected with colleagues worldwide, engaging in dialogues that expanded my perspective and enriched our collective understanding. Lucas's case became a catalyst for professional growth, pushing me to reconsider established paradigms and embrace complexity. On a personal level, the journey was equally transformative. Witnessing Lucas's experience, the uncertainty, the frustration, the resilience, reminded me of the human dimension that underpins every clinical encounter. His story was not just about a scar. It was about identity, vulnerability, and the quest for normalcy in the face of unexplained change. I found myself more attuned to the emotional nuances of patient care, recognizing that managing uncertainty requires more than scientific acumen. It demands empathy, patience, and clear communication. I endeavored to create a space where Lucas felt heard, validated, and supported, even when definitive answers were unavailable. His openness and trust inspired me to deepen this commitment. The case also prompted reflection on the broader medical community's approach to rare and enigmatic conditions. It highlighted the importance of interdisciplinary collaboration and the value of integrating patient perspectives into research and care. Lucas was not merely a subject of study. He was an active partner, shaping the direction of inquiry and treatment. In team meetings, I noticed how the case fostered a culture of humility and curiosity among my colleagues. We were collectively confronted with the unknown, which challenged hierarchies and encouraged open dialogue. The process reminded us that medicine is a continuously evolving field where questions often outnumber answers. Lucas's persistence in the face of uncertainty was a source of inspiration. Despite the lack of a clear diagnosis or cure, he approached each clinic visit with a willingness to engage, to explore new therapies, and to participate in research. His resilience underscored the vital role patients play in advancing medical knowledge, reminding us that the journey toward understanding is shared. The emotional resonance of the case extended beyond Lucas himself. His family's involvement added depth to the narrative, illuminating the ripple effects of chronic medical mysteries on loved ones. Their support and concern enriched my appreciation for the social dimensions of illness and healing. As weeks turned into months, I found that the experience shaped how I approached other patients as well. I became more comfortable acknowledging uncertainty, more deliberate in fostering patient partnerships, and more committed to lifelong learning. Lucas's case was a powerful teacher, illustrating that medicine is as much about navigating unknowns as it is about applying known science. The mystery beneath Lucas's scar remained unsolved, but the journey illuminated profound truths about the practice of dermatology and medicine at large. It reminded me that every patient encounter is an invitation to explore complexity with humility and compassion. In the face of enigmatic disease, our role extends beyond cure to encompass care, understanding, and shared inquiry. This case, with all its challenges and revelations, reaffirmed my dedication to pushing the boundaries of dermatological knowledge. It inspired me to advocate for research that bridges disciplines and embraces the intricate biology of the skin and nervous system. Most importantly, it deepened my commitment to patients like Lucas, whose stories compel us to look beyond the surface and honor the mysteries within. Several months into Lucas Bennett's journey through an uncharted dermatological landscape, a sudden and alarming development disrupted the cautious optimism that had been building. One afternoon, during a routine checkup, Lucas reported an intense episode of sharp, burning pain radiating from the scarred area on his forearm. The discomfort was unlike anything he had previously experienced, severe, episodic, and accompanied by numbness that extended beyond the original lesion. This acute exacerbation raised immediate concern and prompted urgent reevaluation. At Crestwood Medical Center, we swiftly arranged for comprehensive reassessment. Lucas underwent advanced imaging studies, including contrast-enhanced magnetic resonance imaging, MRI, and high-resolution ultrasound, to capture real-time changes in the affected tissue. Additionally, repeat nerve conduction studies and electromyography were performed to assess the functional status of peripheral nerves more precisely. The imaging revealed striking new findings. Beneath the scar, the previously noted fibrotic mass had increased in size and demonstrated enhanced vascularity, suggesting active tissue remodeling or inflammation. More notably, there was evidence of nerve swelling and irregularity within the fibrotic matrix, consistent with neuritis or nerve entrapment. These observations aligned with Lucas's acute symptoms and indicated a progression in the underlying pathological process. Electrophysiological studies corroborated these changes, showing marked slowing of conduction velocities in the small sensory fibers supplying the affected area, alongside increased spontaneous activity suggestive of nerve irritation or damage. The constellation of clinical, imaging, and electrophysiological data painted a picture of a dynamic and evolving condition, one that was no longer static but actively impacting neural structures. This unexpected escalation galvanized our multidisciplinary team. We convened an urgent meeting, bringing together dermatologists, neurologists, radiologists, pathologists, and pain specialists to reassess Lucas's diagnosis and therapeutic strategy. The collective expertise was crucial in navigating this new chapter of the case. Our discussion explored several possible mechanisms underlying the sudden worsening. One hypothesis considered an inflammatory flare superimposed on the chronic fibrotic process, potentially triggered by local immune activation or microvascular injury. Another proposed that progressive fibrosis had reached a threshold where nerve fibers became compressed and irritated, leading to neuropathic pain symptoms. We also entertained the possibility of a novel neurofibrotic syndrome with episodic exacerbations. Given these insights, the team prioritized interventions aimed at reducing nerve inflammation and alleviating pain while attempting to control fibrotic progression. A regimen combining systemic corticosteroids with neuropathic pain modulators was initiated, balancing efficacy with the need to minimize adverse effects. Lucas was closely monitored for treatment response and tolerability, with frequent clinical assessments and repeat imaging scheduled. Simultaneously, we expanded our investigative efforts. A repeat skin and subcutaneous tissue biopsy was obtained, targeting the areas of active inflammation identified on imaging. Histopathological examination revealed an influx of inflammatory cells, primarily lymphocytes and macrophages, in and around nerve bundles, confirming the presence of neuroinflammation. This finding provided a crucial piece of the puzzle, linking the clinical symptoms to a tangible pathological process. Our pathology colleagues employed advanced immunohistochemical techniques to characterize the inflammatory milieu, identifying elevated expression of pro-inflammatory cytokines such as interleukin-6, IL-6, and tumor necrosis factor alpha, TNF-alpha. These molecular markers suggested active immune signaling pathways that might be driving both fibrosis and nerve injury. This deeper understanding informed our therapeutic approach. We considered targeted immunomodulatory therapies that could interrupt these cytokine-driven pathways. After careful deliberation and consultation with Lucas, we initiated a trial of a biologic agent designed to inhibit IL-6 signaling, aiming to quell inflammation while monitoring for impact on scar progression and nerve function. Throughout this critical period, Lucas's experience was marked by fluctuating symptoms and emotional turbulence. The sudden intensification of pain and numbness challenged his resilience and underscored the unpredictable nature of his condition. I made it a priority to provide consistent support, addressing his concerns, managing expectations, and coordinating multidisciplinary care that included pain management specialists and psychological counseling. The integration of these services was vital. Chronic pain, especially when coupled with diagnostic uncertainty, can profoundly affect quality of life and mental health. Lucas's openness about his struggles allowed us to tailor interventions that addressed both physical and emotional suffering, reinforcing a holistic model of care. As weeks progressed, the biologic therapy appeared to stabilize inflammatory activity. Lucas reported a reduction in pain intensity and frequency, and follow-up imaging demonstrated decreased vascularity within the fibrotic mass. Nerve conduction studies showed modest improvements in sensory fiber function, suggesting partial recovery. While these developments were encouraging, the underlying scar and fibrosis persisted, reminding us that the journey toward resolution would be gradual and complex. This phase of dynamic change highlighted the need for ongoing vigilance and adaptability in both diagnosis and treatment. Lucas's case had evolved dramatically, from a mysterious scar to a neuroinflammatory process, manifesting with acute neuropathic symptoms. This transformation challenged us to think beyond traditional dermatology, embracing a multidisciplinary approach that bridged skin pathology, neurology, immunology, and pain management. In reflecting on this critical episode, I was struck by the delicate balance between hope and uncertainty inherent in managing rare and evolving conditions. The sudden worsening was a stark reminder that medical mysteries can shift rapidly, demanding flexibility, collaboration, and patient-centered care. Lucas's steadfastness throughout this ordeal was inspiring. His willingness to engage with complex treatment regimens, participate in repeated testing, and share his experiences openly underscore the importance of partnership in medicine. His journey illuminated how clinical vigilance and scientific inquiry must go hand in hand with empathy and support. As we moved forward, our team remained committed to unraveling the mechanisms behind Lucas's scar and its neuroinflammatory evolution. Each new finding deepened our understanding and refined our approach, reinforcing the broader imperative to explore uncharted territories in skin and nerve pathology. This critical episode marked not an end, but a pivotal juncture, a moment that galvanized our collective efforts to provide the best care possible while pushing the boundaries of medical knowledge. Lucas's case had become a living testament to the complexity of human biology and the enduring quest to comprehend and heal the body's hidden mysteries. In the weeks following Lucas Bennett's acute neuroinflammatory episode, our team undertook a meticulous regimen of monitoring and investigation, determined to unravel the elusive origins and progression of his enigmatic scar. The integration of clinical observations with advanced diagnostic techniques became the cornerstone of our efforts to comprehend the complex interplay between fibrosis and nerve involvement that defined his condition. Close observation was paramount. Lucas returned frequently to Crestwood Medical Center, where we conducted serial assessments of his scar's morphology, texture, and size. High-resolution imaging modalities, ultrasound elastography, and contrast-enhanced MRI were repeated at regular intervals, providing detailed insights into tissue stiffness, vascularity, and structural changes beneath the skin surface. These imaging studies allowed us to track the scar's evolution in real time, correlating physical findings with symptom fluctuations. Simultaneously, electrophysiological tests were performed periodically to monitor nerve conduction velocity and muscle innervation, shedding light on the functional status of the peripheral nerves encased within the fibrotic tissue. These data points were critical in evaluating the effectiveness of our therapeutic interventions and informing adjustments to the treatment plan. Beyond these clinical tools, our investigative efforts extended to the molecular level. Biopsy samples obtained during flare-ups and quiescent phases underwent comprehensive analysis, including immunohistochemistry, gene expression profiling, and cytokinasase. The goal was to identify biomarkers indicative of active fibrosis, inflammation, or neural degeneration, thereby elucidating the underlying pathophysiological mechanisms. Our molecular studies revealed a dynamic landscape. During periods of symptom exacerbation, there was upregulation of profibrotic factors such as transforming growth factor beta, TGF-beta, and connective tissue growth factor, CGF. alongside elevated inflammatory cytokines, including interleukin-6, IL-6, and tumor necrosis factor alpha, TNF-alpha. Conversely, remission phases were marked by partial normalization of these mediators, suggesting a cyclical pattern of tissue remodeling and immune activation. These findings prompted lively theoretical debates within our interdisciplinary team. Some posited that Lucas's scar represented a novel form of localized scleroderma with neuroinflammatory features, while others proposed a previously uncharacterized neurocutaneous syndrome involving aberrant fibroblast nerve interactions. The absence of a definitive diagnostic label underscored the novelty of the condition and the need for expanded research. To explore these hypotheses, we initiated collaborations with external experts in neuroimmunology and connective tissue biology. Together, we designed in vitro studies to model the interactions between fibroblasts and nerve cells under inflammatory conditions, aiming to replicate and dissect the pathological processes observed in Lucas's tissue samples. These experimental endeavors were supported by grant funding secured through our hospital's research programs. Parallel to laboratory investigations, we maintained a patient-centered focus. Lucas's clinical status remained a priority, with adjustments to his treatment regimen guided by ongoing assessments. The combination of immunomodulatory therapies and neuropathic pain management was fine-tuned to balance efficacy and tolerability. Psychosocial support services continued to play a vital role, addressing the emotional impact of chronic illness and medical ambiguity. Throughout this period, Lucas's engagement was unwavering. He participated actively in research discussions, providing valuable perspectives that enriched our understanding of the patient experience. His willingness to undergo repeated testing and biopsies was a testament to his commitment to advancing knowledge, not only for himself, but for others who might one day face similar mysteries. The case's complexity and the collaborative approach it necessitated began to influence broader clinical practice at Crestwood. Educational sessions and case conferences incorporated lessons learned from Lucas's condition, fostering awareness of rare neurofibrotic disorders among clinicians and trainees. This dissemination of knowledge exemplified the ripple effect that a single challenging case can generate within a medical community. As months passed, incremental progress was evident. While Lucas's scar remained present, its progression slowed, and his sensory symptoms stabilized. Molecular markers fluctuated but showed trends toward reduced inflammatory activity. These signs suggested that our interventions were modulating the pathological processes, though complete resolution remained elusive. Reflecting on this journey, I was struck by how Lucas's case challenged traditional distinctions between dermatology and neurology. The intimate relationship between skin and nerve tissue, often overlooked, emerged as a critical frontier for understanding complex diseases. His scar was not merely a superficial anomaly, but a window into the interconnectedness of bodily systems. This realization has profound implications for future research and clinical care. It calls for integrated diagnostic frameworks and therapeutic strategies that transcend conventional boundaries. Lucas's case underscores the necessity of multidisciplinary collaboration and the embrace of novel scientific approaches to address conditions that defy easy classification. In the quiet moments of clinical observation, when I examined Lucas's scar and listened to his experiences, I was reminded of the delicate balance between hope and uncertainty that defines medicine. Each new test result, each subtle change in symptoms, was a piece of a larger puzzle, one that we are only beginning to understand. Lucas's story continues to unfold, a testament to perseverance, curiosity, and the relentless pursuit of knowledge. His scar, once a baffling enigma, now serves as a beacon guiding us toward new horizons in dermatological and neurological science. The journey is ongoing, marked by discovery and challenge, but anchored in the shared commitment to illuminate the mysteries beneath the skin. Lucas Bennett's case had transformed from a clinical anomaly into a profound catalyst for reflection, both personal and professional. As I delved deeper into the complexities of his enigmatic scar, I found myself confronting not only the scientific challenges it posed, but also the broader implications for medical practice and patient care. This journey had reshaped my understanding of dermatology and reinforced the essential humanity at the heart of medicine. From a scientific perspective, Lucas's condition underscored the intricate interplay between skin biology, immune regulation, and neural function. The discovery of neuroinflammatory components intertwined with fibrotic remodeling challenged traditional compartmentalization within medical specialties. It became clear that a siloed approach was insufficient. Instead, a holistic, interdisciplinary framework was necessary to comprehend and manage such multifaceted diseases. Engaging with molecular studies and collaborative research initiatives broadened my appreciation for the evolving frontiers of dermatological science. We were witnessing, in real time, the emergence of novel pathological pathways, neuroimmune crosstalk, aberrant fibroblast activation, and localized inflammatory cycles that had yet to be fully characterized in the literature. Lucas's case crystallized the need for ongoing inquiry that bridges clinical observation with bench research, fostering translational advances that can ultimately benefit patients. Yet beyond the scientific revelations, this case profoundly affected my approach to patient care. Lucas's experience illuminated the emotional landscape navigated by individuals confronting uncertainty and chronic illness. The absence of a definitive diagnosis or cure, the fluctuations in symptoms, and the invisible burden of living with an unexplained condition required a compassionate, patient-centered approach that honored his resilience and humanity. I became more attuned to the importance of communicating openly about uncertainty, managing expectations with honesty while maintaining hope. Lucas's trust and engagement were rooted not only in our scientific efforts, but in the empathetic connection we cultivated. This relationship underscored that medicine is as much about listening and partnership as it is about interventions. The case also reinforced the vital role of interdisciplinary collaboration. The dynamic exchange of ideas among dermatologists, neurologists, immunologists, pathologists, and other specialists enriched our collective understanding and expanded therapeutic possibilities. It highlighted how complex conditions demand diverse expertise and the humility to learn from multiple perspectives. On a personal level, Lucas's journey challenged me to embrace ambiguity with curiosity rather than frustration. It reminded me that medicine is an ever-evolving discipline where questions often outnumber answers, and where uncertainty is an inherent companion. This mindset fostered resilience and adaptability, qualities essential for navigating rare and emerging diseases. Moreover, the case influenced my role as an educator and mentor. Sharing Lucas's story with trainees and colleagues became a vehicle for discussing the limits of medical knowledge, the importance of interdisciplinary care, and the centrality of patient experience. It provided a tangible example of how rare cases can drive innovation and deepen clinical insight. Lucas's narrative also underscored the broader societal and ethical dimensions of medicine. His participation in research protocols raised considerations about patient autonomy, informed consent, and the balance between scientific advancement and individual well-being. Navigating these complexities reinforced the imperative to prioritize patient dignity and choice. Reflecting on the broader impact, I recognized that Lucas's scar was more than a clinical entity. It was a symbol of the hidden complexities that characterize human biology. It challenged us to look beyond surface appearances, to question assumptions, and to pursue knowledge with humility and perseverance. His case has become a touchstone within Crestwood Medical Center, inspiring initiatives to develop integrated clinics that address neurocutaneous disorders and fibrotic diseases. It has spurred efforts to establish registries and collaborative networks aimed at identifying and studying similar cases, fostering a community of inquiry and support. As I contemplated the arc of Lucas's journey, I was struck by the profound interconnectedness of science, clinical care, and human experience. His story exemplified how medicine is not merely a technical endeavor, but a deeply human one, shaped by relationships, curiosity, and the shared quest to heal and understand. In embracing the uncertainties and challenges posed by Lucas's condition, I found renewed purpose and perspective. His scar, once a baffling anomaly, became a source of insight and inspiration, guiding how I practice, teach, and engage with patients. Lucas's case is a testament to the enduring mysteries of the human body and the ongoing journey of medicine, a journey marked by inquiry, collaboration, empathy, and hope. It reminds us that every patient is a partner in discovery, and that within each clinical puzzle lies the potential to advance knowledge and improve lives. As I reflect on Lucas Bennett's journey, I am struck by the profound and lasting impact his case has had, not only on me personally, but on the entire dermatology community at Crestwood Medical Center and beyond. His scar, which first appeared as an inexplicable anomaly, evolved into a powerful symbol of the hidden complexities that lie beneath the skin and the uncharted territories still awaiting discovery in medicine. Lucas's case challenged us to push the boundaries of dermatological research and clinical practice. It became a catalyst for new priorities within our institution, fostering interdisciplinary collaboration, investing in advanced diagnostic technologies, and embracing the integration of dermatology with neurology, immunology, and pathology. The lessons learned from his condition have informed the development of specialized clinics dedicated to neurocutaneous disorders and fibrotic diseases, ensuring that future patients with similarly enigmatic presentations receive comprehensive, coordinated care. Beyond institutional changes, his story has resonated deeply within the broader medical community. It has been presented at conferences, published in peer-reviewed journals, and discussed in academic forums as a testament to the importance of curiosity, perseverance, and open-mindedness in confronting medical mysteries. Lucas's case has inspired clinicians and researchers to remain vigilant for atypical presentations and to appreciate the intricate interplay between different bodily systems. This narrative of the scar and what lay beneath it serves as a metaphor for the broader human experience in medicine. It reminds us that beneath every visible sign lies a complex story, one shaped by cellular pathways, molecular interactions, and the lived realities of patients and their families. The scar, once a silent enigma on Lucas's forearm, came to embody the delicate balance between what is known and what remains to be understood. For me, Lucas's journey has been transformative. It has deepened my commitment to patient-centered care, interdisciplinary collaboration, and lifelong learning. It has taught me to embrace uncertainty with humility and to value the partnerships forged with patients who entrust us with their most vulnerable moments. His resilience and openness throughout the diagnostic odyssey have been a profound source of inspiration. Lucas's story is a vivid illustration of medicine's dual nature, a science grounded in evidence and a humanistic practice rooted in empathy. It underscores the necessity of integrating these dimensions to navigate the complexities of health and disease effectively. His case has reaffirmed the importance of curiosity, not only in seeking answers, but in appreciating the questions that drive us forward. As we continue to explore the mechanisms underlying his scar and similar conditions, Lucas remains an active collaborator and advocate. His experience fuels ongoing research efforts and patient support initiatives, embodying the partnership between science and humanity that defines our work. Ultimately, Lucas's journey is a testament to the enduring mysteries of the human body and the relentless pursuit to understand them. It exemplifies the spirit of medicine, a field perpetually evolving, shaped by the stories of those we serve and the discoveries yet to come. His scar, once a baffling mark of unknown origin, now stands as a beacon guiding future inquiry and care. It reminds us that beneath the surface, there's always more to uncover, and that the quest to comprehend the human body is as vital as ever. In honoring Lucas's story, we celebrate the resilience of patients, the dedication of clinicians, and the unyielding spirit of scientific exploration. His experience enriches our collective journey, inspiring hope and fostering progress in the complex and beautiful landscape of medicine.